Hello everyone, welcome to Radiology cases tutorial. Today we are going to discuss the ultrasound of female pelvis. In this video, we will discuss the sonographic features of uterine fibroids. Now we will discuss the sonographic features of fibroids. The fibroids exhibit a wide range of ultrasound appearances. The most common sonographic pattern is hypoechoic solid uterine mass, although some fibroids are hyperechoic or heterogeneous. The large fibroids are exophytic and can result in a lobulated uterine contour. The peripheral rim of calcification is commonly seen. The fibroids sometimes contain the coarse calcifications in a distribution resembling the popcorn pattern. The identification of a shadowing pattern characterized with the multiple recurring shadows alternating with the linear echogenic areas increases the likelihood that the uterine mass is a fibroid. The shadowing pattern appears like a Venetian blind appearance due to the presence of alternating hypoechoic and the hyperechoic lines. A fibroid can outgrow its blood supply and degenerate, sometimes resulting in the development of cystic areas due to the hemorrhage, infarction, or necrosis. The fibroids may be intracavitary hypoechoic mass and they may also be pedunculated. Now we are going to discuss the wide range of appearances of the fibroids. Now this is a longitudinal transabdominal image of the uterus in a patient which is demonstrating the enlarged uterus, and this enlargement of the uterus is due to the two fibroids which are present here, and both of these fibroids are well defined and mixed echogenic, and this fibroid is also causing the lobulation of the uterus, and the endometrium is visualized here. Now this is an oblique transvaginal image of the uterus, and the endometrium of the uterus is visualized here, and here we can see a well-defined isoechoic uterine fibroid which has the peripheral rim of calcifications along its margins, and this common pattern of the fibroid calcification may be mistaken for the calvarium of the fetal head, particularly if the indication for the sonography is to rule out the retained product of conception following the abortion or miscarriage. Now, this is a transverse transvaginal image of the uterus which reveals multiple coarse calcifications with proper posterior shadowing in a fibroid, and it is resulting in echotexture that has been linked to the appearance of the popcorn pattern. Now, this popcorn pattern is due to the coarse calcifications. Now, this is a transverse transvaginal image of the pelvis, and it shows the fibroids with the multiple well-defined recurring shadows alternating with the echogenic linear areas resembling in the appearance of the Venetian blinds, and this is a common pattern of shadowing originating from the fibroids, and this fibroid is exophytic arising from the lateral margins of the uterus. The endometrium of the uterus is visualized here. Now we are going to discuss the classification of fibroids depending upon its location. First of all, we will discuss the submucosal fibroids. The fibroids which are present in the endometrium of the uterus are called submucosal fibroids. Now this is a longitudinal transvaginal image of the uterus, and it shows a small submucosal fibroid that is deforming the posterior contour of the endometrium. Here we can see the echogenic line which is the endometrium of the uterus, and this fibroid is causing the deformation of the posterior contour of the endometrium. And here we can also see another fibroid which is present in the anterior uterine wall, and small amount of fluid is also seen here in the cul-de-sac. Now this is a transverse transvaginal image of the uterus. This sonogram reveals a small submucosal fibroid which is surrounded by the endometrium of the uterus. As this fibroid is present in the cavity of the endometrium, so this is called intracavitary fibroid. Now we will discuss the intramural fibroids. The fibroids which are present in the myometrium of the uterus are called intramural fibroids. Now this is the axial transvaginal image of the uterus. It shows a well-defined hypoechoic area which is the intramural fibroid. An endometrium of the uterus is also visualized here, and it is completely surrounded by the myometrium of the uterus. Now here we can see another isoechoic fibroid which is present in the anterior uterine wall, and this intramural fibroid is pushing the endometrium of the uterus posteriorly. The fibroids which are separated from the endometrium of the uterus and are abutting from the outer serosal margins are called subserosal fibroids. Now this is the longitudinal transvaginal image of the uterus, and it shows fibroids that are present in the posterior uterine wall, and this fibroid is away from the endometrium of the uterus and abutting the outer serosal margin of the uterus. So this type of fibroid is a subserosal fibroid. Now this is the longitudinal transvaginal image of the retroverted uterus, and here we can see the endometrium of the uterus. This sonogram reveals a large hypoechoic mixed echogenicity area which is away from the endometrium of the uterus, and this large fibroid causing the prominent bulge and the outer serosal margin of the uterus. So this type of fibroid is the subserosal fibroid. Now we are going to discuss the prolapsed fibroid. This is a longitudinal image of the cervix, and this sonogram reveals a hypoechoic mass that is distending from the endocervical canal, that is containing a fibroid that prolapsed from an intracavitary location into the uterine body, into the cervix of the uterus. And this is the longitudinal transvaginal image of the cervix with the color Doppler corresponding to this image, and it demonstrates the blood flow in the fibroid. So this color Doppler proves that this is a prolapsed fibroid. Now we are going to discuss the fibroid with cystic degeneration. A fibroid with cystic degeneration may resemble a fluid collection in the obstructed uterus or the gestational sac. Now this is a longitudinal transabdominal image of the pelvis, and it shows the complex fluid collection in the uterus, and initially it was thought to represent the fluid distending in the endometrium of the uterus, and this is the longitudinal transabdominal image of the pelvis, which is obtained later in the examination after the partial filling of the urinary bladder, and it demonstrates a large exophytic fundal fibroid with the cystic degeneration, and it accounts for the fluid collection seen in the uterus. And here we can see the normal appearance of the endometrium of the uterus, which is located inferior to the fibroid, and it does not contain any fluid collection. Now we are going to discuss the pedunculated fibroids that resembling the adnexal mass. This is a transverse transvaginal image of the pelvis, and it shows a solid mass lateral to the uterus, and it is expected to the region of adnexa, but the mass is connected with the uterus by a short stalk. So this is the pedunculated fibroid. Now this is the color Doppler of the same image, and it demonstrates the blood flow in the stalk which is connecting the solid mass to the uterus, and it is the further confirmation of the mass which proves the pedunculated fibroid. Thanks for watching.